All right, we've got babies on the brain here at News 6. Weekend morning anchor Amanda Castro is anxiously awaiting the arrival of her son, who, by the way, is due today, matter of fact. So naturally, we had some questions about pregnancy and labor, the facts, the myths, all of it. Kirsten O'Connor is out on assignment, so Bridget Ellison is ready to ask a doctor. And we're here today with Dr. Christine Greves, OBGYN with Orlando Health. Thanks for coming back today.
Thank you.
We are so excited. Of course, we're on baby watch. We're waiting on Amanda's bundle to get here. I have a 3-year-old and a 1-year-old, so I know about that road. And, you know, so many moms go through a lot during pregnancy, and then it finally builds up to that moment of labor and delivery. I want to talk a little bit about that, especially with due dates these days. You know, I was a late baby. Some women, you know, end up having longer pregnancies than they anticipated. So talk to us about how the due date is figured out.
Sure. So the due date is an estimate given by your doctor when you go see them. It's basically the date that you're expected to have your baby, but it doesn't mean you're going to have your baby that day. It just means that around that time is when you're anticipating having your little bundle of joy. You could deliver the baby earlier, you could deliver the baby later as well.
Yeah. And so when you're maybe your cycle's not regular and you're not sure what your due date might be, how do you go about figuring that out?
Yeah, that's a great question. So what I would advise you to do is once you know you're pregnant, make a phone call, go in and see your doctor about that. But what we do once you're there is we would perform an ultrasound and try to assess basically what the size of the baby is. Typically, if you have the ultrasound earlier on in the first trimester, it's more accurate. So that gives us a better idea of when you're going to have your baby.
Now, sometimes it seems like it's spot on. Like people go in on their due date and have the baby. Like it's like clockwork.
Yeah.
You see that a lot.
Not always, because sometimes things come up in life, right? What if you break your bag of water early? What if you have diabetes? What if you have high blood pressure? Stress, certain things like that may prompt you to go in earlier than expected.
So you see a variety.
Yes.
Yeah. So let's talk about the other side of that pendulum where, okay, we're at my due date. Now we're past the due date. Now we're 7 days past the due date. I mean, you must have ladies coming in begging to, I want to have this baby.
Yes.
So what can we do?
Yeah, so that's a wonderful question. Definitely, you're in there for the appointment, talking to your doctor, getting an exam, seeing what your cervix is, and we don't, just to give everybody hope, we do not want you to be pregnant past 41 weeks because it's not there's no advantage to your baby or to you.
Okay.
However, some women, like you just asked, what can I do at home to try to help? There are different things you can try. However, nothing has been truly proven to work.
They're like old wives' tales.
Correct.
But you're saying a lot of them don't hurt anything. Let's talk about castor oil.
Yeah, that, primrose oil.
What do you do?
Intercourse, things like that. Different things. Some people want to eat spicy food, or they walk a lot around Disney World. I had one patient.
Don't ride the rides. Don't ride any unapproved rides.
Yes. But, and the baby didn't come out. but if it makes you feel better, if it makes you feel like you're gaining your strength, like you're trying something, because as humans, we all want to try to do something to try to help move things along, right? But I guess to answer your question, there's nothing that we can do at home to cause an induction of labor per se. That's something that needs to be done in the hospital, monitored by your doctor, unless you just spontaneously go into labor. I have had situations where patients have done that and associated with it, but it doesn't mean it caused them to go into labor.
Well, what about this? What about those false alarms? And better to be safe than sorry. What should you do if maybe you're not sure, like, am I in labor or is this normal? I know one day after the morning show, I ended up on the couch in the green room and my tummy felt really tense and tight the whole show. And I thought maybe I just need to rest. But I ended up having to go in and just be monitored.
Yes.
And it ended up being like Braxton Hicks. So explain how that all plays out when you should go in and get checked.
That's a great question. You did exactly what you're supposed to do. Basically, I would recommend if you start feeling contractions, I tell patients if you're feeling contractions and if they're regular and they're not going away with rest and hydration, Okay, if you feel a lot of leaking, if you have any bleeding, if your baby isn't moving the way that it normally is or should, then those are things that should prompt you to go. They should prompt you to go get evaluated, depending on your gestational age. But usually, if you have any concerns, that's what we're here for. We have, our hospital has a place called triage where we can get evaluated, or you just call and go see your doctor depending on the concern. But basically, if you just feel like things are not right, if things are changing, because in medicine, trends are everything.
Yeah.
So go get evaluated.
Yeah, and it's a little scary sometimes to go into the hospital when it's not time to go yet, but it's better to be safe than sorry.
yeah.
It'll be okay.
Yes, peace of mind.
Yeah. All right, thank you, doctor.
Anytime. Thank you.
All right.